Hello, everyone. We're so happy to have you here with us today for our discussion about engaging dads in services for families affected by substance use disorders. It's really exciting to have a big audience today. We are very grateful for the funding that we receive from the National Center on Substance Abuse and Child Welfare, from the ACYF Children's Bureau, and from the Substance Abuse and Mental Health Services Administration. Today we have an illustrious panel of panelists and staff who will be working on our session today and providing information. And I wanted to let you know who's here so you can see their faces.
And hello, everyone. Before I begin, I just want to wish all the fathers out there a happy belated Father's Day this past weekend. We have really been looking forward to this conversation about father engagement. And based on the attendance of our webinar today, we can tell you are too. Before we jump into our site examples and ongoing efforts and strategies to engage fathers, we want to review how we got here, the historical context, including our country's past of anti-poverty and social policy development. Back in the 1700s and 1800s, our government created categories of worthy poor, defining poor women with children as in need of public support, while focus on poor men centered on the need to financially provide for his children. Later on, the federal assistance program Aid to Families with Dependent Children, including what many refer to as the man in the house policy. This included some specific disincentives for father engagement and marriage, with benefits only being available to mothers if there were no male living in that household. Eligibility workers would conduct unannounced home visits to ensure that there were no men living in the household, using strategies like looking for men's boots under the bed or men's clothing hanging in the backs of closets. This rule was active throughout the 1960s and is part of a long and paternalistic history of punitive regulations. For quite some time in the United States, to access child support has required single parents, usually mothers, who apply for public assistance programs like TANF, the Temporary Assistance for Needy Families, to disclose the paternity of the absent parent and then sue them to establish child support obligations. Katie is going to share 2 links to evaluations that look at the experiences of individual families and fathers' financial support of their children. Much of our country's poverty and social policy has greatly shaped the role of fathers for some of the most vulnerable children and families, including driving fathers into underground economy to avoid large sums of debt or even avoiding jail time, or families being forced to choose between informal and financial support from fathers. Much of the stigma and many of the challenges from these policies remain through generational trauma and even through current practices. Though we now recognize the benefits of a father's involvement, many social policies continue to be coercive, focused on marriage as an avenue to father involvement and continuing to focus heavily on a father's financial support and marital status. These policies disproportionately affect fathers of color. Over time, we have looked at fatherhood differently. Beginning in the 1990s, there was concern about father absence. David Blankenhorn identified the decade as the decade of the disappearing father. It is important to note that not all fathers were choosing to be disconnected. The war on drugs and mass incarceration was a major contributor to this, especially for males of color. The decade of the re-engaged or reappearing father in the 2000s saw a focus on initiatives, programs, curricula, funding, and research on father engagement. Next, the decade of the integrated father is the decade in which we value the role of the father and identify fathers as a fully engaged and integrated member of the family. Right now, we are still in that space between the re-engaged and integrated fathers. You'll also see that note at the bottom that some men don't have strong role models of how to fulfill those new roles, the education needed to support them. I like to think about in terms of pop culture and media, how fathers are often depicted. It's more common and changing over time, but back in the 90s, we think about Homer Simpson or about Family Guy and some of those caricatures of what was being depicted as a father. And we're glad to see some of those change over time. This slide includes just a couple important notes about the costs of father absence. Again, we want to highlight that this absence is not necessarily by choice, and these costs can be tied directly to mass incarceration. These statistics and many more are available from the National Fatherhood Initiative at fatherhood.gov, which is a great resource for all sorts of information related to father engagement. All right, we just walked through a very brief snapshot of the historical context. Now we want to focus on one question. Why is it important to engage fathers? As you see from just a few of these outcomes, fathers make a clear impact on their children, from better cognitive outcomes all the way to lower levels of alcohol and other drug use and higher levels of empathy and other pro-social behavior. I want to note that this says involve fathers. So it's not just saying married or in-home fathers, but it applies to all involved fathers. We recognize that the impact that historical trauma, racism, and the systematic removal of fathers from family systems, which includes slavery, internment, boarding schools, mass incarceration, have lasting impacts on families throughout generations. We encourage you all to partner with persons of color to help provide and support the unique needs of individual groups and individuals as well. Here are just a few groups down at the bottom of the slide that provide training for working with specific populations. We also need to identify that we need to have a family-centered approach. This means serving men directly, but also recognizing that their relationships and roles that they participate in. Substance use disorder treatment and collaborative partners should look at the diverse needs of the men they work with, which might mean building new partnerships. We will be discussing more about collaborations in just a few minutes. Addiction is a brain disease and one that affects an entire family. We need to acknowledge this in order to reduce stigma for individuals and families. The best way to recover is to treat and support the entire family. The work of all community partners must reflect an understanding and responsiveness to the fact that parents and children live within the context of a larger family system, and that families exist within the context of their community and culture. The cultural influences of race, ethnicity, religion, geography, and customs are considerations that must be prioritized when implementing a family-centered approach. Father engagement is all of our responsibilities. We must work together to prioritize father involvement in their children's lives at every level. And with that, I'm going to kick it over to Sean to discuss engaging dads in plans of safe care.
Thanks so much. Well, again, we have talked about the need of engaging fathers within the prenatal period as a whole. And really, there's a phenomenal mechanism, the plan of safe care, which is used to really provide resources, tools, and supports to the pregnant individual, their infant, and their families. And so this plan of safe care provides a key opportunity to engage fathers during that prenatal period, during the birth event, and postpartum as well. So I'm going to talk about that here briefly. We can go to the next slide. So first, dad's role in the prenatal period. There was a phenomenal space to engage fathers during that prenatal period. But as we know, like, there isn't a blueprint necessarily for how to respond during that prenatal period. You know, we say all the time, like, man, whenever we have kids, there's no playbook, there's no blueprint on what to do. Well, for fathers, that's especially true when it comes to that prenatal period. And a lot of fathers have a heightened anxiety because what they're doing during the prenatal period, they're trying to fulfill a diverse scope of roles, you know, whether that's providing support to the pregnant individual and then postpartum moms, and then also nurturing and increasing their attachment with the infant. So there's so many different roles that the father is trying to fulfill during that time that heightens that anxiety level. And then we find that during the prenatal period, the majority of the focus of services and supports revolve around that mother-infant dyad. And so a lot of dads may struggle to focus on their own needs during that time. Again, as lots of services and supports are focused on the mother and the infant, and a lot of the focus just in general within maybe the family unit, the extended family, the community are all focused on the mother and infant. And then even dad, the work that he's doing, the support that he's providing is focused on the mother and the infant. So sometimes during that piece, the dads may not focus on their specific needs. And then another piece about a dad's role during the prenatal period is there is a space for dads to take on that role as nurturer by, you know, really really about nurturer and provider, and that these roles are kind of being recalibrated during this prenatal period. In fact, that prenatal period all the way through early childhood is a key space and a key window for a dad to really define their fatherhood roles within that family. So I think it's super important that with the plan of safe care that we leverage that tool, that coordinating tool of a plan of safe care to engage fathers like never before. Next slide. And then of course, the mental health of dads during this prenatal period is paramount. And a lot of times we see that a dad's mental health is directly related to that pregnant individual's mental health as well. So we see that their decline in mental health during that prenatal period, it can be overlooked because again, the majority of the focus is on the mother-infant dyad. And then not only that is when it comes to identifying the need for mental health services, for some men that it looks different. You know, it may be that they're physically present, but they can be emotionally isolated. So then the question is, as service providers, how do we identify that and how do we engage that father in as many services as possible? And like I said before, one of the biggest effects to the mental health of dads during the prenatal period is just that lack of attention and the identification of the dad's needs. Again, if we're not paying attention to it and we're not identifying those needs, then there's not that firm connection with services and access. Next slide. And then, so again, Plan to Safe Care, I cannot say enough about just how phenomenal that tool is. It's going to help identify treatment resources for both parents. And in fact, that Plan to Safe Care, it's a support for families as a whole, not just the mother-infant dyad, but there's space in there to include the dad in those treatment services and supports. And then the Plan to Safe Care has been shown to reduce maternal mortality and to keep families intact, which is the goal of the Plan of Safe Care. And then again, the level of coordination and the level of support that happens through the Plan of Safe Care provides a wealth of benefits to the mother baby dyad, but then also to the father as well. So again, this is a key place where we can really increase our engagement of fathers throughout that prenatal period. Next slide. And then the last piece that I have before we dive into the conversation with our phenomenal panelists is just the challenging of engaging dads in the Plan of Safe Care. You know, that increase in maternal infant mortality, especially among persons of color, that can create additional stress for the dads during that prenatal period. And then there's also cultural barriers that exist and maybe not wanting to reach out for help. You know, whether it's stigma, whether it's bias that the dad has experienced. So there are those cultural barriers. So the question is, how do we recognize those barriers, and then how do we still identify and engage fathers in the Plan of Safe Care? And then again, one of the biggest changes is just that experience of discrimination and the fear of further discrimination that fathers may experience. So whether it's, you know, engagement with the child welfare system, or an idea that if I engage to a certain degree, I'll be at risk of losing our child. Again, there's all of these ideas and these biases and this discrimination that happens, and it can create another barrier for dads to be involved in plans of safe care. So these are things that we should keep in mind, and that you're about to get an opportunity in a second to hear from some of our great panelists who've done a phenomenal job at engaging dads and overcoming these barriers. So with that, I'll turn it over to Will, who's going to lead us into the panelist discussion.
Great. Thanks so much, Sean. And as we jump into our dialogue, we first want to thank our panelists for joining us, as Sean just sort of introduced a little bit. And now I'm going to ask each of you to introduce yourself and give us a brief explanation on why the topic of engaging fathers is important to you. Let's start with you, Josh.
My name is Josh Cunningham. I work for Creoaks. I'm a peer recovery support specialist. I started out as an FSP, do a little bit of everything. I am an addict in recovery. I've lived an interesting life. I had, at a young age, I went through a lot. Both my parents are addicts. Most of the people in my family are either in the drug game or addicts. And so I know what it's like to go through the court system. I know what it's like to feel like people are judging you and like you don't belong and like you can't speak up. And so it kind of gets me in my heart, and it's important to me to make these guys feel like that they're like inclusivity is a real thing. And so it's hard for some people because some people that are recovering addicts and grew up like it's hard to trust the people you love, let alone a government entity or anything like that. So that's why it's important to me.
Great. Thanks, Josh. And Joey, I'll pass it over to you next to introduce yourself.
How you doing, guys? My name is Joey Font. I'm a peer recovery support specialist here at Hushabye Nursery in Phoenix, AZ. And it's important to me to make sure dads get engaged because, you know, I think it's so important that the dad has that pivotal role in the relationship when a baby's going to be born. It's important for them to feel like they're involved in the way that they can be there for their partner and their child at the same time. You know, I'm a recovering addict. I used opiates for about 10 years. I got sober when I was 26. I relapsed once. I'm 29 now. I went back to school. I got my degree. I have a beautiful, almost 3-year-old son. I'm on methadone, and it's really important to me to make sure that those fathers get a chance to share their side of things and make sure that they are connected as well as the mother, because she's getting all that care, and it's important that the father stays in that web of connection as well. So thank you guys. I appreciate it.
Thanks, Joey. Next, I'll pass it over to Samantha, and you're with CREOX also, just like Josh. And so if you could just tell us a little bit about your program, that'd be great.
Yeah, good afternoon, everyone, or morning, depending on where you are. My name is Samantha Bowman. I am the Assistant Clinical Director of Children's Services at CREOX Behavioral Health. Essentially, I'm over all of our child and family programming for our agency. CREOX is predominantly in rural Oklahoma, where there is not a lot of resources. And as a result, we are always looking for ways to identify underserved populations. And about 3 years ago, we received a grant where one of the focuses was on fatherhood engagement. And at the time, we were like, oh my gosh, this is an underserved population that we didn't even realize that we're not necessarily catering our services to these individuals. And so for 3 years now, we have been focusing on fatherhood engagement and integrating different services and supports into our system in order to help fathers and the entire family be successful. So that is one of the reasons why I'm really passionate about this topic. I'm happy to be here.
Great, thank you. Next, I'll pass it to Sean, and if you could tell us a little bit about Hushabye Nursery as well.
There we go. Hi, I'm Shauna Anderson. I am the Education and Volunteer Coordinator at Hushabye Nursery. Hushabye Nursery is a two-sided facility. We have inpatient care for infants exposed to opioids and wraparound care for their families. So we do both inpatient and outpatient supportive services for families. We have just really realized we opened our physical doors in November of 2020, but our founder, Tara, who is on with us today, she started services in 2016 with families. And we know that families are more successful when dads are engaged in services. We know that families do better. Even if families can't be together, even if mom and dad can't be together, co-parenting and dads who are actively engaged in their children's lives from pregnancy, the birth event, and beyond, we know that's how we start to reduce those generational effects of trauma. And so engaging dads is a very important part of our model.
Great, thanks. And last but not least, Tara.
Yeah, I am Tara Sundem. I am the executive director and founder of Hushabye Nursery. And I think babies need their moms and babies need their dads. And that's the biggest thing. Dads don't always think that they can be there. They don't realize that our services are for them also. And a lot of times it's us not saying, oh, mom and dad, but they just need to know that you're definitely invited. And we want you to understand everything that mommy's doing, because this is for your baby. It isn't just for mom. And babies withdraw easier with their moms and dads. To raise a baby is so hard, and everybody needs to be on the same page. So.
Great. Thanks so much. And again, thank you all for joining us for this important conversation today. Our next question, we are discussing a range of fathers just within this conversation about plans of safe care. Each father should be treated individually as a unique individual with his strengths and needs specific to him and his family. Today, we are discussing fathers with substance use and or mental health disorders and dads whose partners have substance use and or mental health disorders. We specifically want to discuss culturally diverse fathers and families. What are some of the challenges you have seen working with different types of fathers, and how have you overcome those challenges? We'll start this one with Samantha.
So as I had mentioned, our agency is a community mental health center within rural Oklahoma. And as a result of our geographical location, I think for a lot of our families that we serve, and even maybe some of our community partners, there still can be a bit of stigma in regards to getting mental health and substance use treatment. You couple that with being someone who maybe traditionally or historically hasn't really been engaged in these types of services. And I think that it really contributes to maybe a lack of trust within the system, maybe a lack of confidence that these services will help you, or that they're really geared towards you, or will you get anything out of it? And so all of these different things really play a part in maybe fathers not feeling as engaged in services, and even for us as providers, maybe not doing as good of a job engaging fathers historically. Sean had mentioned in his part of the presentation that we typically focus on the mom and the baby, especially during pregnancy. There's a lot of focus on that dyad of the mom and the baby, and maybe the parents are together, maybe they're not together. But I think that this shift of recognizing that fatherhood engagement is really important to not only treatment and making sure that individuals are getting services and support that they need, but it's also really important to the overall success of a family unit. I think that moving in that direction and helping our families and our community partners understand that is really going to help with moving this initiative forward nationwide.
Great. And Joey, do you have anything to add to that about other strategies that you've used to overcome some of those challenges?
Yeah, I mean, I think it's huge when I believe Sean spoke on it, or you did. The mental health of a father can be often overlooked. I think when it comes to barriers, they just need to know that they have support. Like, it needs to be a father-friendly space, right? So they come into this environment with their partner, whether they're going to end up co-parenting or, stay together for their child. They need to know that it's a safe place for them. They can open up, they can be truthful. And in the end, the common goal that we have in common with anyone that comes to Hushabye is, we just want you to go home with your baby and enjoy that baby and have a good life for that baby. That's essentially what it comes down to. So that's just my piece.
Great. And I think something that I didn't mention, but something that's really important is having fathers running these services. Josh and Joey are on this call. They're fathers. They have lived experience. They've been there, done that. And I think just, the research really supports that anytime you have peer-led groups or services, that there's always a better response. And so we really can't downplay the importance of having father peer supports in place in order to help our dads feel really comfortable in the services that we're providing.
Great. And Joy, you said something that jumped out at me about having that father-friendly space. And it reminded me of a free resource that the National Fatherhood Initiative has available. called the Father Friendly Checkup, which is sort of like a walkthrough that you can access on their website to make sure that your agency or that your space really is father friendly. Yeah, great thoughts all around. Does anybody else have anything that they want to add about other challenges and strategies that they've used to overcome those strategies?
I think one thing that a Hushabye does is, when we say congratulations, when we meet a family for the first time, many times it's like to mom, you see your pregnant belly and you're like, oh my gosh, congratulations. But then really looking at the dad at that same time and going, I'm so excited for you. That you just start seeing that trust, you break down the barriers and they start to trust you. And I know that Joey, you had said, it's a scary, scary situation. And who are these people that are supposed to be helping us? Are they really going to help us or not? And you have to start making sure that they know that we're just here to help, not to tattle on them, to make sure, yes, that their baby's healthy, that they're safe, and if we can, keep them unified.
I try to build a personal connection and just let them know I'm there, let them know it's safe, let them know that I know what it's like to struggle, and that we're, as substance abuse and addicts in recovery, and we're all going to fall, we're all going to make mistakes. It's not about, I always tell people our knees get banged up. It's all about how you brush them off. It's all going to be all right. We got you. And all you got to do is reach out.
Yeah, the last thing I would just add is, looking at programming, making sure that your programming, for us, we had to take a look at our programming and say, are we making a conscious effort to have not just programming that is for the whole family, but father specific, so that they have a place where it's just dads getting together, having conversations, being able to be like, yeah, I don't know how to change a diaper. I'm really freaked out about changing a diaper and I don't know if I'm going to do it right. And swaddling, are you kidding? That looks so hard. And just having a space where you're like, hey, we're all new to this. Let's do it together. And having somebody like Joey, having our dads help lead other dads in those new scary skills in a place that's just really low pressure, where we can laugh at ourselves and learn skills that are going to help us to bond with our kids, because that's what we really want dads to be able to do.
Yeah, I have started a dads group, and that's what it's all about. It's just dads supporting dads. Like, I didn't have anybody teach me how to tighten a tie and to get dressed up and to how to talk to people in public and stuff like that. And some of these guys have never had a job interview, or they just need someone to talk to. You never know.
Awesome. Well, I kind of want to follow up Will's questions, and I want to zero in on that prenatal care / early postpartum time frame, and really talk about or ask the question on what are some of the challenges to engaging dads specifically during that time frame, but then also what are some of the benefits that you've seen when it comes to engaging dads during that window. And I would kind of pitch that to Shauna and the work that y'all done in Hushabye first. If you could talk a little bit about that again, the challenges to engaging them during that time frame, but then also some of the benefits.
Absolutely. So one of the, I think, challenges that we have with dads is there's a real fear of what is going to happen after baby is born. So we know that when a baby is born substance exposed, there's going to be DCS or CPS, whatever you call it in your state, involvement. And so that can be a real challenge. And it can be, sometimes there is this idea that if I just kind of ignore this, it will go away. And then I'll deal with it when baby's born. But what we have found is that if we can help the entire family be prepared for what that is going to look like, they become so much more confident, and they understand, okay, I have a plan. We have a binder that we work through that helps parents to identify their family care plan. They identify who their responsible adults might be. They have a relapse prevention plan in there. They're tracking all of their groups and their classes and any services that they're doing so that they feel really, really confident about what is going to happen after baby is born. The other thing is that just preparing them for what a substance exposed pregnancy and birth is going to look like. The more that we can help families to advocate for themselves and to find, to have that knowledge about what's going to happen, they're confident, they are going to, it's just going to go so much better. And that's really probably our main goal prenatally, is how can we help them to feel educated, prepared, and supported. And Tara, if you want to add to that.
I think that's great. I think the big thing is educated, supported, and them being able to voice what they know and be confident in what they know. And I think when you have mom and dad together, sometimes moms are not well, and we have dads actually participating. Sometimes it's that situation, and it's a matter of the families that do best for us are the ones that are engaged, that trust what we say, and they've heard things over and over and over again. And when they've done that, they are confident and they're like, I know what's best for my baby. And they're able to either help their partner with that, or they're able to just kind of, I hate to say it, but stick up for themselves and advocate for their baby. That's the biggest thing. I think a lot of times families with substance use disorder, opiate use disorder, a lot of times we forget that that's their baby. That isn't, it is not someone else's baby. And to really make sure that the families are able to say that nicely, with respect to, I want to say, to the authorities, to the doctors and nurses, and to Child Protective Services.
Gotcha. It almost sounds like, Tara, when I hear you and Shauna talk about it, is one of the benefits is an increase in confidence, but then empowerment, actually empowering the families, empowering the fathers, via those resources and supports, to whether it's advocate for themselves, to truly lead out and own their own journey. I just think that's huge what y'all are doing. Now, I want to switch it a little bit. And I know we've talked some about, again, fathers that are currently engaged, but what are some skills, what are some tools or resources, or what do y'all do with fathers that may not be initially engaged during that prenatal / early postpartum time frame?
At Hushabye, we have one group that initially we were doing it as daddy boot camp, but I think we changed it to baby boot camp, Shauna, because we found that not just dads wanted to attend, there were other supports that wanted to attend. But really in that group specifically, them understanding, how to care for your baby, how to do all of those specific things, and really educating them and empowering them, just like you said, Sean. The other thing that we do is once a month, I jump on a group and just talk about where we came from, help families. If there's someone that doesn't understand opiate use disorder or substance use disorder, really going through that and educating them so that they really can be a support system to the mom who is struggling or to the mom that's in recovery. A lot of times they don't get it. And I didn't get it. I mean, I didn't understand. I was like, why didn't you just stop using? And didn't understand that it was chronic illness, that it's a brain disease. And when you know that and you see the research, you're like, oh, okay, it's a total different change. And so a lot of times we just have to get families and daddies to understand that even if say they have opiate use disorder, having them have that aha moment of, I'm not a bad person. I have a chronic illness. I have a brain disease, and my diagnosis is opiate use disorder or substance use disorder. When you see that aha moment, which I think is from education and truly being empowered, you just see a total flip in being able to advocate for their whole family system and to step up.
Gotcha. That's good. I would think the next question that I have revolves specifically around plans of safe care. And I know Samantha, you and the entire staff at Creox, y'all done a phenomenal job. Y'all are really trailblazers within the state of Oklahoma when it comes to implementing plans of safe care, especially during that prenatal period. So I would ask, how have you utilized that plan of safe care to engage fathers during this process?
Yeah, so we started doing plans of safe care about 3 years ago when we got that grant that I had mentioned. And, the first step for us with really engaging fathers, occasionally you'll have a family unit where mom and dad are together. They plan to have the baby together. They plan to stay together, to be a family unit, to co-parent. That's really beautiful when that happens. More often than not, we find that that's not really the case. And so we had to do a lot of work with our community partners, specifically with our child welfare partners who are engaging both parents in their own services and making sure that the family is safe. And what we started out doing was offering those kind of support groups that there's no expectations, there's no curriculum. Come in, talk to other dads. And from there, once you start feeling confident and comfortable, let's talk about other services that might be beneficial to you and your family. So that's how engagement starts. A big part of our process is the plans of safe care, and it's really important for us to be able to fill out this living, breathing document with the entire family. And so it's not a one and done form. We fill it out with both caregivers if possible, which we've had a lot of success, again, due to our community partner buy-in with getting everyone engaged. But the plan of safe care really does look at what each individual member of the family brings to the table. What are their strengths? What are their connections? How can we make sure that when the baby is born, that the child and the family will be safe and they'll be able to maintain within the community? The way that we use our plans of safe care is they go into a binder that has all different things in it from a family's services with us. And so that includes the caregiver's relapse prevention plans. It includes a family care plan. We do wraparound services as well with a lot of our families. And so it includes strengths-based assessments and what are their goals that we're working on. Have they had any crisis situations come up since they've been engaged in our services? We have crisis plans and safety plans. All of these different documents go into a binder that the family ends up taking with them to the hospital whenever they give birth. And fortunately, because we have done that level of engagement with our community partners and our child welfare partners, we have successfully had 92% of our births, 92% of our babies have been able to go home with their parents as opposed to being taken into custody, which is huge for us because in Oklahoma, we tend to have a lot of families that are DHS involved. And so for 3 years, we have had very, very good success. And it does come back to making caregivers feel confident, like, hey, I've been working with these people at Creox for a year. This is all the work I've done in a year. Yes, I am a recovering addict, but I have the tools and the services and the support that I need to keep my baby and my family safe. And fortunately, we've had just really, really positive buy-in from everyone that we've engaged with this initiative. So,
yeah, I like what you said, Samantha, about engaging other partners in this process, because I think it's super important that, again, this idea of how to engage fathers, this isn't an idea that's owned by one agency. And it's like, it's all on one agency to figure out how do I engage fathers in my community. It's truly a cross-systems collaborative approach to engaging fathers so that they feel engaged with both the child welfare partners, the mental health and substance abuse treatment providers, early childhood education, so on and so forth, to where they all come together and figure out how can we engage the fathers in our community. So that, I think that's huge that y'all are engaging partners at that level. So with that, I'll turn it over to Will for the next set of questions.
Yeah, I think we've heard a lot of really great strategies from really kind of creating a space for fathers that is open and engaging. We talked about how we think about some of the stigma and bias that we identify, and a few of those other strategies. But I was just curious, For anyone that's interested in implementing some of this father engagement work, like Sean said, it is up to a whole collaborative. It's up to a whole community. It's up to our whole country, really, to some degree. But what are some next steps that you all can share with us about taking that next step? Where do we start? If I could hear from Shauna first. Do you have anything to say?
Yeah, I think a few things come to mind. I think number one, just kind of going back to that, really taking a look at your physical space, your virtual space, what your programming looks like, and ensuring that it's father friendly. Something as simple as, do you have groups available for dads who work full time, who aren't available until 5 o'clock at night, or need to do something on the weekends? And I think, there's little things. I think so often we think that we need to have these huge, like, okay, we're going to reassess everything we're doing, and this is a new initiative, and, everybody get on board. But it's really simple. It's like, can we add a week once a week, a group once a week at 6:30? And can we make sure that it's easy for families to get there? Can we help? Do we need to help with transportation? Do we need to make sure that there's childcare? So kind of just making sure that that physical or virtual space that you've created is father friendly. And then I think one of the things that happened for me when I started working at Hushabye, I had worked at the last place I worked at was really more focused. It was specifically for pregnant mothers. And I had to consciously change my language and say that our services were family centered. And so I had to, constantly say, we want our families to join groups. We want families to be a part of our services. What are we doing to include families? Because I think, especially when we're talking about pregnancy, the tendency is to focus on moms. And so shifting that from moms to families. And then I am a huge believer in peer supports, having people like Joey and Josh who are there to help make that first connection, to help explain, hey, here's everything that we have to offer, and here's how I can walk alongside you. And then I think the last would be looking at your programming. Like we had to look at our programming and say, what can we do that is father specific? Yes, everything that we're doing is family specific, but we need some stuff that's just for dads. It's a really safe place for dads. So that's where I would start.
I would also just add, don't make it hard.
Yeah.
Don't just make it simple. Start with like a 20 minutes. This is focused on dads. It could be the same group, but this is when we're going to do it. So have your partner jump on it this time. You don't want to miss the last 20 minutes. It doesn't have to be hard. And then if you're lucky enough to have a daddy peer support, those two things, make it easy.
Great, thank you. And we've had such great chat participation. I'd love to see in the chat what some of you all are doing to improve your father engagement in your local sites. Joey, is there anything else that you'd like to add about other ways to begin that process?
Having dad specific classes is, huge, right? I think, first and foremost, I would say, having a daddy like myself and Josh that can be there to talk to the other fathers that come in, like at Hushabye with their significant others. Here at Hushabye, we also have a therapist, right? So for those that are going to end up together, they're going to co-parent, right? They have that option to talk to one of the therapists and kind of work on how they're going to both benefit their child in the long run. And, also, I think that man-on-man time, kind of in a sense with another father is huge too, because it's a way to just connect, and it's a better way to get through them sometimes. I'm not saying always, but most of the time it is.
Joey, I've had simplicity has been really the answer. I do after work at about 6 or 7. If guys want to come, I'll meet you at the park, or we can go get a hamburger. We can meet together, just me and you. We can, I do that. And something as simple as when when you're taking something to the mom, like diapers and a present and stuff, because we do stuff like that, take something for the dad, tell him congratulations, make him feel, because they're excited too. Some of them don't. Like in our society, we kind of, absent fathers is kind of the way it is. Like that's just what it is. It's time to turn it around.
Great. Thanks so much, Josh. All right. And then next, we just want to hear a little bit about what you all have seen in terms of benefits for both the dads individually, as well as for those families. Samantha, I think I saw the chat was kind of exploding when you were talking earlier about that 92% of children going back home. And so that's obviously a huge one, but any other positives that you all have seen? And Josh, I'd love to start with you.
Oh, they're huge. Like you see the dads, like you can see the fact that they can come out of depression and feel like you can tell the difference. You can see when they're included just when you're talking to them. Like I had a dad last night who's struggling, he's got a demon on his back and he wants help, but he didn't, honestly, no one had ever told him that hey, you can get help. Like there's someone here to help you. So just like telling him, hey man, I went through the exact same thing you went through, and I'm standing here now talking to you, helping you, and you could be doing the same thing, and seeing how much positivity that brings into their lives. It's changed my life.
Great. Thanks, Josh. And Joey, I'll pass it over to you. Any other benefits that you've seen for both dads and for families?
Yeah, I mean, simply just having a dad in a family dynamic alone that's involved. I mean, that right there alone is so huge. I mean, having a father in any child's life is probably, in my opinion, one of the biggest things. You need a father figure, right? Like it benefits the family in the long run when daddy's involved, plain and simple. There's there's nothing else to it. That's as easy as it gets. And I think involving the dad is so necessary. And as long as, people like us and we all keep fighting to do it, then that's a good thing to fight the stigma.
Great, thanks. Anything from any of our other panelists about other benefits that they've seen?
I would just reiterate what Tara had mentioned earlier. When fathers are engaged, when they're in the nursery, when they're bonding with those babies, they physically do better. Babies who are born substance exposed and they're going through those withdrawals, they know their daddies and they want them there. It's not just physical. I mean, it's not just the emotional support, it's their physical presence. And that's something that surprised me. I'll be honest, when I started at Hushabai, but it's so true. And, it's so cool when you're back. We have a in-person, nursery, and I'll go back there every once in a while. And to see a dad start, holding this newborn baby who's going through withdrawals and they're not sure if they're doing it right. And maybe by day 3, they're swaddling and they're using our, we call it the squat, they're squatting down and up and they're shushing that baby. And they're so confident. And then they go home and they have all these little tricks. And they say, we have one dad that said, everybody needs an exercise ball. You got to get an exercise ball. And he tells all the other dads, you got to get an exercise ball. Just to see that confidence. And I think you start that young. You start it when baby is 2 or 3 days old. And then all of a sudden, those dads have that confidence that when their kiddo is 2 years old, that they've got what it takes within them, and there's resources and they can get help. And then that kiddo is 5 years old and 6 years old and 8 years old, and it goes on and on and on. And that dad has that confidence to know that he can do it. And that is what keeps our family systems really strong. So I just love to see that confidence.
Absolutely.
Yeah, I think that, outcomes are really important. Keeping families together is really important. It's certainly one of our greatest goals that we're working towards. But at the end of the day, just as a society, mentally healthy and happy people raise mentally healthy and happy people. And in the climate with everything going on in the world, I think we could all use a little support for our mental health. And just trying to help people feel as confident in life as they possibly can.
Absolutely. And I know we're running low on time, but I wondered if anybody has any insight into any positives or benefits for the mother when the father is actively involved.
Yeah, I would say that it's a huge, I mean, it's a bonus. If you have a dad that's supportive for mom, it's like, oh, touchdown. Families are all going through the emotions, and when you've delivered, you have your ups and downs and you don't know what you're saying. And when the dads are there, just being able to reassure and also to help advocate and be like, no, this is what I've learned. I've learned this about Hushabye. I know what my baby needs. And the moms are able to go, yeah, what he said, because I don't know. I can't even think. I'm exhausted. And what we see a lot at Hushabye is we can have it where families can stay 24/7 while their baby's going through that withdrawal, and us really them knowing that they can take turns. Okay, you're going to sleep for 3 hours. Now you're going to sleep for 3 hours, and you're going to trade off. I wasn't a single mom. I can't imagine doing it on my own. And when you have a dad there and a mom, so maybe, because sometimes we do have it's daddy there, mom is not. But when you have a dad and a mom there, you have two people. It's 2-to-1 instead of just 1-to-1. That baby doesn't win. It's just huge.
Josh, did you have something to add to that?
Like you talked about in the beginning of the meeting, for a long time, there was no dads didn't matter, and for a long time, that's on the dads just as much as it is on society and everything else, because the dads are the ones that checked out and said it's okay too, and that's part of the things that I try to teach too, is like, hey, to be a dad, you got to be a man, you got to stand up, you got to do certain things. And that's what it's about. Like, reach out. It's okay to be emotional. So like, that's one thing I also want to push is like, cry. It's okay. It's not a couple tears ain't gonna break you. And it's gonna do wonders for your kids just to see it. So.
Awesome, man. Josh, I appreciate that insight. And I would just say too, thank you to all the panelists, man. You've provided a lot of rich content, a lot of not just the ideas that fathers should be involved, but y'all really provided a lot of practical steps that I really feel like those attending can use going forward. So if we'll bring up the slide deck real quick, there's just a couple of things before we leave here in the next 5 minutes that I wanted to really leave the attenders with. And I want to talk through a little bit, again, just those strategies for engaging dads. So if we could go to the next slide. And again, one of the things that we've seen, that we've heard from our panelists and we've seen across the board, is that education is key. Short-term and long-term education is huge when it comes to engaging fathers. And kind of like Tara, Samantha, and others, Sean, were saying, is that education equates empowerment. It gives them confidence to be able to advocate for their family and be able to move forward along in their journey. And then, as we've seen through the work that Josh and Joey have done, is peer support services and those groups to provide that emotional support are huge. There is nothing like having a father who has walked this journey before, to have a Joshua or a Joey, walk shoulder to shoulder with you as you're going through this journey. Again, so just peer supports are huge. And then that counseling and mentoring, case management. And then I really want to just sit on that community awareness piece. I think that is so integral to engaging fathers at that next level, really ensuring that the community sees value, and that having engaged fathers, especially during that prenatal period, it's not just a value added thing, or, oh, that's icing on the cake. That, no, this is integral, and this is a critical part of providing a safe and healthy home for that infant. And kind of like Samantha was saying, when you have healthy and happy individuals, they raise healthy and happy children. So again, that community awareness and community support is just huge. So next slide. And again, for the sake of time, I won't go through all this in detail, but it's super important that we, again, that prenatal period is just so critical when it comes to engaging dads. So I think it's important that they see themselves and that they see a role when it comes to providing that loving and nurturing environment for themselves, the mother and the infant, that they really see purpose and they see where they fit in that place as well. And then again, recognizing the value and their ability to contribute to financial well-being is huge as well. They want to be seen as someone that is supporting that family unit, whether that's, through housing, childcare, other means like that. But it's just super important that that we provide environments and that we have supports to really foster that within the dads. And then again, identifying those dads that may be struggling with their mental health or with a substance use disorder, that's going to be huge as well. And so I think you've heard from both Hushabye and Creoaks how they're going about engaging dads at that heightened level. Next slide. And then of course, the Plan of Safe Care. Samantha talked about how they engage fathers through their Plan of Safe Care. And I love how they do a lot of these things that are listed here. So I won't go through them verbatim, but man, they're engaging dads and they're starting from that place of the dad wants to be involved. So they're creating space for the dad to be involved. It's not okay, well, if you're interested, here's how you can get involved. No, they're starting from that belief that fathers want to be involved in this process. And then again, creating, those spaces that are dad friendly, as we say. I always say all the time, like if you walk into a facility or organization, does the dad see themselves? Do they see themselves in the waiting room? Do they see themselves in the conversation? So that's huge as well. And then ensuring that dads are recognized in the Plan of Safe Care. That's what I love about the work that Hushabye and Creoaks are doing is they actually, if you look at their binders, there's space for the dads. Something as simple as that, says to a father, I have value. So that's just a huge part of engaging dads throughout the Plan of Safe Care process. Will, if you can go ahead and take down the slides for me. One of the things that we want to do too, as the National Center, there are a host of resources and supports that we have that really speak to this issue of engaging fathers in plans of safe care, engaging them during that prenatal period and beyond. So we're going to make sure that we make those available and that we make those available to you and that we make that website available where you can get those resources. So with that said, I'm going to turn it over to Katie Ryan, who can wrap it up for us.
I'm pretty sure there's nothing I can say that's better than what's already been said, except just thank you so much for being with us today. Thank you so much to our panelists. Thank you, Sean and Will, for leading us through this process, and have a wonderful day. Thank you, guys.